Humans are remarkable. We mapped the stars. We built civilizations. We split the atom. We engineered rockets that reach other worlds and heavens. We communicate at the speed of light. And yet, for all of our intelligence, our oldest human habit still humbles us. In a quiet room under bright lights, a woman lies exhausted, while her body prepares for something violent, sacred, and ancient. Because despite everything we have conquered, we still have a very hard time giving birth. 9 months of careful, energy-demanding pregnancy, followed by hours of grueling labor. And the strangest part is not that childbirth is painful. The strangest part is that it had to be. Why is the fetal head so large it barely fits through the birth canal? And why does labor take so long? And why do human babies arrive so unfinished and so unready for the world? The answer is not a coincidence. It's an ancient compromise, a biological tax we pay for the most powerful brain on Earth, and for most of history, that tax was paid in full with blood. Childbirth is an epic event, an event that completely changes the life of a mother and an entire family. And today we consider an obstructed or difficult labor to be the exception, not the rule. Birth has become so routine that a lot of women choose the exact date to deliver their babies. But this safety is a very new phenomenon, barely 70 years old. Before that, the death of the mother, the child, or both was the most likely outcome. And even if the mother survived, she often faced permanent physical disabilities such as uterine prolapse or sexual dysfunction. And in an era without contraceptive, a woman can face up that risk up to 10 times in her life. So why is it painful? The pain begins with our anatomy. At the base of the uterus is the cervix, a thick muscular canal about 3 to 4 centimeters long. During the pregnancy, it stays closed like a sealed door, locking the baby inside the womb. But at the end of the pregnancy, the door must open. But it doesn't just swing open easily. It dilates slowly and painfully for hours, while the uterus contracts with immense force. The first stage of labor can last up to 12 hours, as the cervix opens to 10 centimeters. The second stage can last up to 2 more hours of intense contractions with barely a minute of rest in between them until the mother pushes the baby through the birth canal. And finally, the third stage, where the placenta is delivered, the temporary organ that fed the fetus oxygen and nutrients and filtered its waste for months. Even among mammals, human birth is unusually long and physically demanding. A 1999 study examining thousands of births found that human labor averages around 9 hours, far longer than any primate who sometimes can do the job in 2. But the most revealing difference, it's not the length, it's the helplessness of our babies. After 9 months of pregnancy and hours of labor, a human baby arrives unable to walk, unable to eat, and unable to survive without constant care. A foal stands within an hour. A whale calf swims immediately. But a human infant is born like an unfinished project, incomplete and fragile. It takes years for the brain to fully develop, and it even takes months for the body to be able to hold itself upright. If nature was very efficient, why would evolution design a birth that is this difficult only to deliver babies that are so unready for life? The answer lies within one brutal contradiction. The fetal brain wants to grow, and the human pelvis won't allow it. Every centimeter the fetal skull gains is a centimeter closer to getting stuck, and that conflict created one of the most famous problems in human evolution, a problem known as the obstetric dilemma. The obstetric dilemma argues that childbirth became difficult for one reason: walking upright. When humans evolved bipedal movement, the pelvis transformed. It became a structure designed for balance, efficiency, and endurance. A wider pelvis might have made childbirth easier, but it would have weakened the mechanics of walking and running. So natural selection and evolution made a trade: a pelvis narrow enough to walk, and a fetal head small enough just to pass through it. But the margin is terrifyingly tight. The human fetal head is so large that birth becomes this physical negotiation, a slow twisting passage through the bone. And sometimes that negotiation fails. And in modern times, this margin becomes even tighter. Conditions like obesity and diabetes can increase the fetal size, making labor harder and increasing the risk of obstruction. According to a study at a Dublin hospital, the average weight of fetuses in the year 2000 was a full pound heavier than in 1950. For decades, the obstetric dilemma seemed like the final logical answer, but modern science has complicated the story. New research suggests the EGG hypothesis, which stands for the energetics of gestation and growth. As the fetus grows physically and mentally in the womb, its energy demands skyrocket, and that's why women in late pregnancies feel often an intense hunger. It's not for them, it's for the little monster inside. And in the later stages of pregnancy, the fetus requires specific massive amounts of energy, like long-chain fatty acids, that the placenta struggles to provide. Where do they eventually get it from? From mama's breast milk. Pregnancy pushes the mother to her absolute metabolic limits. She reaches a point where she simply cannot reach the fetus's energy demands anymore, and according to the study, birth occurs when the fetus begins to starve. The history of childbirth is a sad story. In my opinion, it is the most tragic story in the history of medicine, and the people who paid the full price were mothers. For centuries, childbirth was a strictly female domain. It was attended only by the mother and the midwife. And historically, medicine was not very kind on women, often reducing them to their reproductive functions and diagnosing them with hysteria for all the behaviors that were deemed unnatural. For centuries, women were misunderstood, mistreated, and excluded from medical research. And even later, when male midwives began to appear, they worked entirely blindfolded in order to not see the female genitalia, because culture and religion deemed it to be taboo back then. But in the 16th century, men finally found their way into the birthing room, thanks to a brilliant invention. The Chamberlain family in London invented the obstetric forceps, a tool used to extract the baby head through the birth canal during difficult labor. Before this simple yet genius invention, if a birth was obstructed, the midwives used to take the horrifying decision to crush and kill the baby to pull it out in order to save the mother's life. And because of this, the demand for the Chamberlain family services increased. And since business was booming, they treated their invention like a military secret. Only they were allowed to attend these difficult births. They even blindfolded the mothers so that no one would learn of their secret tool. And that held until the 18th century when the design finally leaked. But it leaked only to male doctors, men who spent centuries trying to enter the birthing room. When they got the secret, they began to fiercely compete with the midwives. And this became the ultimate clash between empathy and technology. Midwives didn't have these tools, nor were they trained on them, but they cared deeply for the mother's mental and emotional state, sitting with her for hours and sharing a brutally difficult experience. After all, most midwives were mothers themselves. The male doctors, however, had nor the patience nor the emotional connection, and because they lacked experience with laboring women, they often used the forceps in a reckless fashion. They injured more fetuses, they destroyed more cervixes, and even used the forceps unnecessarily just to rush things out instead of waiting for a safer, longer natural birth. This reckless use gave 18th and 19th century doctors a terrifying reputation. People viewed them as butchers. And again, because of religion and cultural taboos back then, obstetric training was incredibly poor. A doctor could graduate medical school without even having seen a natural birth before, which led to catastrophic rushed mistakes. In the 19th century, mothers would endure a grueling labor, barely survive, and then contract a postpartum infection known as childbed fever. And remember, this is not a one-time event. Without contraception back then, a woman would face this risk up to 10 times in her life. And since doctors had no scientific methodology back then, every doctor had his own baseless theory on why this was happening. And this is true, by the way. Some doctors claimed that the mother's breast milk had spoiled and then intoxicated the mother's blood. Others blamed mothers for being too anxious. Some blamed the dirty bed sheets and nurses. But the fever raged on. Then in 1846, a Hungarian doctor named Ignaz Semmelweis arrived at the Vienna General Hospital, the largest maternity hospital in the world back then. The hospital was split into two wings, one for the doctors and the medical students, and one for the traditional midwives. Semmelweis noticed that the pregnant women rushed to the midwives' clinic. If they found out that it was full and they were being transferred to the doctor's clinic, they would weep and beg and plead not to go. Some women even preferred giving birth in the street rather than going to the doctors. For many women, reaching the doctor meant certain death. And Semmelweis found out that these women were entirely right. The infection rate for childbed fever exceeded 18% in the doctor's ward, meaning that 1 in 5 women died. In the midwife's ward, it was less than 3%. Amazingly, the women who gave birth in the street recovered, while those in the pristine doctor's ward died. And Semmelweis was a scientist, so he became obsessed. The beds were the same, the food was the same, and the midwives' ward was actually more crowded, which should have meant higher infection rates. He studied the midwives for a year, until he found the answer. The only difference was that the doctors were performing autopsies on corpses in the hospital, moving directly from the dissection rooms to the maternity wards. And at this time, the culture of washing your hands still did not exist. As humans, actually, we didn't wash our hands for most of history. So doctors would dissect a rotting corpse, then go deliver a baby using the same exact hands. They were directly transferring germs from dead bodies to mothers and babies. Semmelweis was struck with immense guilt. He knew that he performed more autopsies than anyone. He said, "God only knows the number of patients that went to their graves prematurely by my fault." He then implemented strict procedures, forcing doctors to wash their hands with caustic solutions after dissecting a corpse. The mortality rates dropped from 18% to 2%. But despite this incredible discovery, arguably one of the most important in the history of medicine, Semmelweis was met with rejection. The doctors, with their egos back then, refused to take the blame and felt insulted. And some went to absurd lengths to deny his findings, claiming that women were dying because they wore tight skirts that caused feces to build up and poison their blood. And by 1849, Semmelweis was an outcast from the medical community. He called the doctors that rejected his theory murderers, rightly so. 16 years later, he died alone, depressed in a mental asylum, and generations of mothers continued to die after him due to the stubbornness of doctors. His theory was not accepted until Louis Pasteur arrived and proved the existence of germs. Eventually, he was revindicated. He was named the savior of mothers, and the Semmelweis effect was coined to describe the reflex-like rejection of new knowledge because it contradicts current norms. Obstetrics has a history where doctors were often the biggest obstacles to progress, and mothers often paid the ultimate price for medical evolution. And we see this clearly with Dr. James Marion Sims. Unlike Semmelweis, Sims was not an outcast. He was widely known as the godfather of gynecology and was the president of the American Medical Association. In the 19th century, the fistula was a devastating common problem after childbirth. And because the bladder, the vagina, and the rectum sit closely in the woman's pelvis, the prolonged pressure of the baby's head could destroy the blood vessels between them, and this created a hole between the organs, causing lifelong incontinence, infections, and suffering. And this problem persisted because the doctors refused to examine female genitalia due to cultural taboos. Then Sims found a brilliant solution. Between 1846 and 1849, he invented the vaginal speculum and developed excellent surgical sutures that saved the lives of women and mothers to this day. But there's a dark side to this doctor. To perfect these incredibly complex surgeries, he needed to practice on real women, and Sims decided to practice on enslaved black women, based on the racist belief back then that black women did not feel pain the same way white women did. He performed his surgeries on 3 enslaved women, Anarcha, Betsy, and Lucy. Anarcha alone underwent 30 fistula repair surgeries. And remember, this was before the invention of anesthesia. And while Sims acknowledged that their role solved massive problems for humanity, these women had no say. They had no control over their bodies to consent or to refuse these horrific sacrifices. And because he treated enslaved women like laboratory animals, his statue was removed from New York in 2018. In 2021, a monument was erected in Alabama to honor Anarcha, Betsy, and Lucy, officially naming them the mothers of gynecology. History often immortalizes the doctors, but ignores the patient. Sim's story reflects dark history, where women endured humiliating, destructive experiments. It highlights the second worst aspect of childbirth after death: the pain. A pivotal moment in the history of pain management occurred at Massachusetts General Hospital in 1846 when Dr. William Morton successfully used ether as an anesthetic. This opened the door to chloroform. In a not-so-verified tale, a Scottish anesthesiologist used chloroform on a mother who was so overjoyed by the pain relief that she named her own daughter Anesthesia. However, the culture fought back again, insisting for some reason to always make the worst possible choice for women. The religious leaders argued that scripture mandated that women must suffer during childbirth, claiming that using anesthesia made you sinful and unfit to be a mother. It took Queen Victoria to personally intervene and change the culture. She used chloroform during the birth of her own children, which made the drug known as the Queen's drug. And by the time the antibiotics were introduced in the 1930s, the equation was finally balanced. We left behind an era of infections and reckless doctors. By 1960, the era of home births ended. Women chose the hospital because the old fear of doctors was gone. The hospitals had highly trained doctors who washed their hands, wore gloves, used painkillers, and administered antibiotics. We entered a new era promising easier pregnancies. But this ease brought with it some new complications. On November 25th, 1960, the First Lady Jacqueline Kennedy gave birth to her son, John. The American public was shocked because the baby arrived almost a month earlier than it should have. They soon learned that she underwent a cesarean section. In 1963, she had another C-section, though tragically, the baby died from placental abruption. According to Jacqueline Wolfe, the author of the book Cesarean Section, Jacqueline Kennedy unintentionally transformed a rare, terrifying surgery into a completely normal practice, with modernized surgical incisions that allow women to wear bikinis in summer. Before the Kennedy babies, the C-section rates were tiny. After, they spiked by 455%. But the C-section has a much older history. The word traces back to the Roman law under Caesar, which ordered the mother abdomen to be cut open if she was dying, strictly to save the child. It was a desperate measure. In the 19th century, doctors only resorted to it if the forceps failed or if the baby was lodged high in the pelvis. Some studies at the time claimed that there were almost no survivors from the C-section. The real shift that made it a modern surgical staple was the invention of the ultrasound. After the Titanic sank in 1912, ultrasonic wave technology was developed to detect invisible icebergs. The military used it then to detect submarines deep in the ocean. Eventually, a Scottish doctor realized that there was no fundamental difference between a submarine deep in the sea and a fetus deep in the womb. With this device, we could see the fetus's size, movement, and gender. Our relationship with the unborn completely changed. The stomach ache became a baby kicking. Mothers started naming their babies before they were born. And over time, the fetus officially became the patient. When fetal heart monitors arrived in the 1970s, we could detect fetal distress immediately, making the C-section a constant, ready option to rescue the baby. And this spared the mothers massive amounts of physical and emotional pains. According to a 2023 study, one of the main reasons why women choose the C-section today is the pure fear of the pain of natural labor. Now you can undergo a 30 to a 60-minute surgery, wake up and find your baby in your arm, completely avoiding the 50-hour ordeal. In the 1970s, the global C-section rate was 7%. By 2021, it reached 21%, 1 in 5 babies globally. By 2030, it is projected to hit 30%. Is this a good thing? According to the World Health Organization, C-sections are an incredible life-saving tool in times of fetal distress. However, it also states that the ideal natural rate should be between 10 and 15% globally. Reaching 30% is dangerous because it opens the door to other kinds of complications, like severe bleeding, like hysterectomies, and an increased rate of children having autoimmune conditions and allergies, or even diabetes. The C-section is like any medication, vital when you need it, but dangerous if taken for no reason. The reality was that most women actually preferred natural birth. With natural birth, a woman can recover within hours. With a C-section, it takes weeks. The studies revealed that the real reason for the spike is that mothers were not being given detailed medical information. They often did not feel the real difference between the two procedures, and the decision was almost always left to the doctor. Many doctors in many countries intentionally chose the C-section because it takes far less time. Sometimes the mothers choose the surgery out of fear, and sometimes the doctors choose the surgery out of convenience, and sadly sometimes profit. The solution, according to the medical officials of the WHO, is for every mother to have a detailed medical conversation with her doctor. She must participate in the decision-making process, fully understand her specific medical case, and even ask for the hospital C-section statistics before making her choice. And of course, for medical institutions to operate with more transparency. The story of childbirth is a story of anatomy and evolution, of progress and arrogance, of a science that saved millions and a science that sometimes advanced by taking what it had no right to take. But above all, childbirth is a story of women. Women who labored without anesthesia, women who died from invisible infections, women who survived and carried lifelong injuries in silence. Generation after generation, the continuation of our species is rested on their endurance. And even today, in a world of machines and medicine, childbirth remains one of the few instances where humanity is reminded of its origins. Not in power, not in technology, but in pain, blood, and breath. Because every civilization, every empire, every scientist, every soldier, every king, every new couple in love began the same way. In darkness and in struggle, and then a first cry. And in that first cry, life does something extraordinary. It begins again. My name is Zaki, and I'll catch you on the next one.